Good afternoon, my name is Marsha. I'm going to be talking today about your blood pressure. I am a hospital corpsman in the Navy, so we do vital signs pretty much every day. It's a basic, check for all of our patients that come in. And I mean, your heart is one of the hardest working muscles in your body, and you would think the people would be more knowledgeable about that muscle because it is pretty much the one that keeps you alive. But it's really surprising how little people know about their blood pressure and their heart in general. And today I'm just hoping to give you a real basic introduction to your blood pressure. There's many aspects of your blood pressure you should know. Today I'm just going to talk about symptoms of high blood pressure, which is also known as hypertension, symptoms of low blood pressure, which is hypotension. I'm going to talk about the top 10 ways you can lower your blood pressure without using medication. And I'm also going to do a very brief demonstration of how to do a proper blood pressure reading. Hopefully this demonstration will give you a better understanding of your blood pressure and will give you the most basic tools used to monitor your own health. One of the most common preventable diseases out there, one of the most common deaths out there is heart disease. And the most common indicator that there's an issue with your heart is hypertension. According to WebMD, the most dangerous aspect of hypertension is that a lot of people really just don't know that they have it. A lot of the symptoms of hypertension can be mistaken for something else. And also, people really don't monitor their blood pressure. You go in, the doc takes it when you're going for your regular visit, and that's about it. They don't pay attention to their readings. They don't know their baseline. They don't know if maybe their blood pressure isn't normal for them because the doc says, hey, you're good to go. No big deal. Baseline is really important because it gives you a way to notice, hey, my reading is way off from what it was last time. So it's really good to know your baseline blood pressure. If you run high all the time, then it's normal for you to have a high reading. But if you don't, then that's when you need to start looking out. Some of the severe hypertension will exhibit some, if not all, of these symptoms. You'll have severe persistent headaches. You'll feel tired, confused. You might have blurry vision or visual disturbances. Labored breathing, irregular heartbeat, blood in your urine, which is kind of rare, and then a pounding in your chest, neck, or ears, and that pounding is really just your heart really struggling to pump blood. Left untreated, hypertension can lead to heart attack. It can lead to stroke, and then eventually cardiac arrest. And high blood pressure can also lead to kidney failure and vision problems. As dangerous as it is, having blood pressure drop too low can also lead to health problems. According to an article I found in the Mayo website, low blood pressure can signal other health problems that you may not even know that you have. Especially if you exhibit low blood pressure dropping, if your blood pressure drops suddenly. Some symptoms to be watchful with low blood pressure would be dizziness or lightheadedness, fainting, inability to concentrate, again blurred vision, nausea, cold clammy skin, rapid shallow breathing, fatigue, you're feeling depressed, or you have a sudden thirst. Oftentimes these symptoms on their own are kind of insignificant. You're really not going to notice, okay, I'm just feeling dizzy, maybe I need to drink some water. But if you experience these all together all at once, or if it's a sudden occurrence of these things, you should go see your doctor because it could be something more serious. The important thing to remember about heart disease and hypotension is that making simple changes to your lifestyle can really improve your blood pressure readings. While conducting my research, I discovered an article about the top 10 ways to lower your blood pressure without using medication on the Mayo Clinic website. First and foremost, of course, you want to pay attention to your body weight. That also attributes to how much weight you carry around your waistline. A lot of people don't really think that's a big deal, but for some reason, the weight you carry in your weight actually attributes to how hard your heart works. So we really want to make sure that we're at a good, healthy weight, and that if we are a little overweight, we try to not make sure that weight's not here in our belly area. Number 2 is, of course, establishing an exercise routine and sticking to it, which will help you maintain your safe, healthy body weight. And once you're doing your exercise, you should also monitor what you're eating, what you're putting into your body, because all 3 of those together can really, really drop your blood pressure reading quite significantly. Number 4 is limiting your amount of sodium, how much salt you throw into your food. And one recommendation they say for that is instead of using salt, you should season your food with herbs or spices. And to slowly wean yourself off, because a lot of us Americans, we like our salt. Limiting your alcohol rings in at number 5, and then the amount of caffeine that you use comes in at number 6. For number 5, the recommended amount of caffeine or an alcohol for women is 1 drink per night, and that also includes men over 65. For men under 65, it's about 2 drinks per night. It's about what they recommend. Try not to go over that. The most difficult one, of course, we have quit smoking or dipping or whatever kind of tobacco use you have. And then reducing your stress comes in at number 8. Number 9 would be self-monitoring your own blood pressure, and then number 10 would be seeking support from family and friends. Following these 10 simple steps and monitoring your blood pressure regularly correctly can ensure your heart is as healthy as it possibly can be, at least from where you can control. The next and most important step is making sure your reading is accurate. So now I'm going to show you the real basic steps into checking the blood pressure, if I can get a volunteer. You want to know, or you want to pay attention to, is your surroundings. It needs to be quiet so you can hear your heartbeat through the stethoscope. And you want to be calm. You want to have been resting for about 5 minutes. Try not to drink coffee, work out, be driving in traffic about 30 minutes before you're reading. You want to make sure that you bear the entire arm up to the shoulder. And then you want to place it so that this indicator here that says artery is laying on or about the same area as the artery that runs right about here on your arm. You also want to make sure that your cuff is the right size for your arm. If it's too small or too big, you're going to get an inaccurate reading. Place the stethoscope in your ears, and it's usually just going to be this way. Place the reading here on the vein. You're going to pump it up until the gauge reads at about 140. Once it gets to 140, you're going to stop pumping and you're going to slowly release the air out of the pump, paying attention to when you hear the heartbeat come back and start beating. You're going to document that very first heartbeat, and then you're going to listen until the heartbeat stops and document that heartbeat. That will give you your systolic and your diastolic reading, which is your blood pressure. Average for somebody in his condition, 120 over 60 is the ideal reading. But again, you need to know your baseline so that your reading is accurate for you and what's right for you and your body style. Today we've covered basic signs and symptoms of hyper and hypotension. We've talked about how to do a proper blood pressure. We talked about the importance of monitoring your blood pressure. I thank you guys for paying attention, and I appreciate you coming and watching me